Well, aside from working full-time as a dentist, I'm also in the Army in the reserves. So that takes up a lot of, like my weekends and vacation time. So a lot of times I'm doing training and preparing for my duties as a dental officer. And then other than that, I just spend time with my friends and family. I like to relax when I have free time, watch TV, play games. When I was finishing up my biology degree, um, it just kind of came up as an opportunity. My aunt was on dental assisting. Wasn't really sure what I wanted to do at the time. So I kind of started shadowing in the office where she was working. I liked what I saw. I had some strength in science. I liked the idea of healthcare, the idea of being able to help people out with medical issues. I like the idea that I would be able to use my hands, be artistic in a way. And so all those things kind of lined up. I did my undergraduate at UOP in Stockton, and I was a biology major there, so I have my Bachelor of Science in biology. And then I went to UOP, Dagoni, and San Francisco for dental school. And I did a one-year postgraduate residency after dental school. For me, it's definitely the feeling of helping patients to be better off leaving the office than when they came in. So a lot of times, if somebody has dental pain or a dental emergency or a really big issue that's affecting their daily lives, they can't work, they can't take care of their kids, they can't sleep, they can't function, and then to be able to treat them in that setting so that they leave able to carry on with their lives and they're out of pain. And it gives me, like, just to be able to offer people relief gives me a sense of satisfaction. I mean, there's many types of dental emergencies that we handle all the time. Usually with a patient will come in with a toothache or a swelling. It sometimes can happen really suddenly, and so it's unexpected, and patients can be really fearful, and they're not knowing what they're going to do, and if it can be fixed. So with that, we're usually just looking at treating infection. So for that, maybe we're pulling a tooth, maybe we're doing a root canal, or maybe we're medicating. But just taking care of that patient and a little bit of treatment for them can go a long way. We have a good team of dentists. We all work cooperatively, so we all kind of see each other's patients. We're all kind of on the same page when it comes to our idea of the standard of care and what we do to treat specific conditions that we see. And so because of that, we have the chance to see each other's patients. So that makes it makes our schedule really flexible. So patients who may not be able to get in for weeks or months at another office will have the chance to get pretty quick treatment. So that's one thing. And the other thing I would say is that we don't sacrifice our standards for care in the interests of profit. So we try to keep the prices pretty low, but at the same time still providing a good quality of care.